Just put everything in the oven, Carla.
Welcome everyone. Thank you so much for joining us on this Saturday afternoon. It's pretty gloomy over here in Subang, so I hope the weather is all good at your end. Welcome to My Story, and today we are proud to have Dr. Hana from UKM to share with us on diet and children with autism, right? Allow me to do a quick introduction. We at My Story, we are actually a training center for children with special needs. And yeah, the services that we do, we provide academic support for children who are actually in school but currently or may actually struggle with academic learning environment. So it could be challenges in time management, completing homework on time, or maybe they have some social issues with friends, not making enough friends. So that's where the academic support team comes in and support our children with some of the learning strategies that the teachers will work with the child, right? In addition, we also have behavior management, majority working with younger group of students, supporting them as well as parents to manage certain behaviors that we tend to see. Either we eliminate them or we want to encourage the good behaviors instead of the not so good behaviors, right? We also have classroom readiness. So classroom readiness is for children who are probably going into school but may have challenges following school environment, being able to work independently or following instructions. So this is where the students who are under the classroom readiness will go through. On top of that, we have counseling, diagnosis, and assessment. So counseling currently, we have a counselor, Charlie, on board who support parents in their journey, whether you want to decide whether you want to get your child diagnosed, what do you do after you get a diagnosis assessment, how do you plan, where to look for help, where to seek therapy. All those are actually covered pretty much under the counseling and guidance under Charlie. For diagnosis and assessment, we do have a clinical psychologist on board. Currently, we do the two assessment, which is under autism as well as ADHD. So you will probably be coming across if you follow our live session, where we have the Ask Charlie Anything sessions with Nurul Liana. She's our clinical psychologist on board to support the team as well, right? Then in addition, we have occupational therapy, physical therapy, reading therapy, as well as speech language therapy. So these are the therapy services that are commonly needed by our children with special needs. We work in an interdisciplinary model. So a client who comes in maybe in behavior management and occupational therapy so that we can support the child in different kind of setting as well as achieving the goal to support the child as a whole. Okay, that's pretty much the introduction about my story and who we are and what services we offer. So that's enough about my story. Let's hear about Dr. Hana instead. Dr. Hana is currently a senior lecturer at the Dietetic Programs and Research Center of Rehabilitation and Special Needs, Rehab, Faculty of Health Science, UKM. She is passionate in improving children's nutrition intake, specifically for those in special needs group. She actively involved in the fundamental of intervention research grants, focusing on this area as well. Her ultimate goal is to establish a one-stop nutrition or dietetic center in providing education, training, and services for individuals, families, carers, and health practitioners related to special needs. So let's welcome Dr. Hana. Dr. Hana.
Hello, hi, Miss Ling.
Hi, Dr. Hana. Thank you so much for being with us this afternoon.
My pleasure.
Yeah, so Dr. Hannah has prepared a great presentation for us, and it's a topic that she's very passionate about. So it's all yours, Dr. Hannah.
Okay, thank you, Miss Ling. All right, I'll share with you my slide. Okay, all right. I hope you can see the slide now. Yeah.
Yes.
All right. Okay. Thank you, Miss Ling. All right. First of all, I would like to thank Ms. Chiling, Ms. Pua Chiling, and everybody from Mind Story for inviting me to this session. It is my honor to share with you, with everybody here, about nutrition, especially in for children with autism spectrum disorder, because my work mainly looking into the nutrition adequacy and the therapy, nutrition therapy for children with autism spectrum disorder. I involved with a feeding clinic, autism feeding clinic in CDC, Child Development Center, HUKM, for several years now. We have a multidisciplinary team in that clinic. So I hope to share with you some of my research findings and some of the things that we came across, during the clinic, so that hopefully we can benefit the information with everyone. Okay, so let me start our today's talk with the title. All right, we are going to talk about nutrition and autism spectrum disorder. Okay, all right. So what are we going to cover today? We're going to focus on two things. First is the importance of good nutrition in children with ASD. And secondly, the potential differences of nutrition-related aspect between child with ASD and typically developing children. The reason why I love to highlight the importance of good nutrition is because we know that families with children with autism, autism children usually have lots and lots of therapy sessions that they need to go to. And sometimes, when they come to us and then, oh, actually there's something that we can actually also do to improve the nutrition intake and also overall the nutritional status of the children. Okay, and then secondly is about what are the main or most common question that I got during my clinics. All right, so I'll be sharing some with you guys today, and with the support of the research that we have came across. Okay, so I think most of you already know the definition, but I will just go quickly because I really love the way this site presented the definition in a infographic style. So we can see here the autism is actually on the rise from 2012 to 2014. All right, it has increased from 1 to 88 to 1 to 1 child in 68 children. So there's a 30% increase of diagnosis, children diagnosed with autism spectrum disorder. And then when we look into the IQ level, all right, we know that some autism have higher IQ, sometimes has similar IQ with their typical peers, and some autism with intellectual disability where the IQ is less than 70. So there's a quite range of IQ level between among children with autism spectrum disorder. All right, and then there are also some characteristics, okay, that we also discuss in identifying probably the signs, that probably might highlight and you want to look into in more detail and see the clinical psychologist or the pediatrician, to confirm later on. So some of them do not like to be touched, do not want to be touched because of the social factors, right? They do not have the eye contact especially when spoken to. And they like to be by themselves, right? And then sometimes they like to play, put their toys in a row, something like that. And some also show exceptional skill in a specific area, for example, math or music. Because I have this one friend of mine who shared with me, one of her students can learn several languages. And the child can even speak the language of Germany for German language, and also Korean if I'm not mistaken. So they have a very a special skill, I would say, because probably those are the one with the higher IQ. All right. Now we can also see more of boys diagnosed with autism spectrum disorder compared to girls. Even the characteristic also more of it's more prominent among the boys compared to the girls. All right. So okay, now we move to the most common eating problem among ASD child. All right. Mainly 75% of the cases that we see in the clinic are related to eating behaviors. All right. So even this study also confirms it is more than 50%. I think in my cases, it is even 75 to almost 90% of the patients who comes in when we assess them. It is mainly related to eating behaviors. Okay, so why eating behaviors? So there are several things that falls under eating behavior. So the most commonly that we always hear is about picky eaters, all right? And then non-functional mealtime routine, selective food refusal. They're being selective and then, no, I don't want this. I only want that in that packaging at this temperature, at this color, you know, that kind of thing. And also they have some tantrums. Usually when they are triggered, then they show their tantrum that might influence their later intake. All right. So when we talk about picky eating, which is a study that I've now have a PhD student who is looking specifically on picky eating and sensory issues. They are very closely related, meaning that when we look at those picky eaters, especially in autism spectrum disorder, it is related to sensory issues, especially in the
I'm sorry, doctor, is it my line or is it your line? In case doctor do get disconnected, she will definitely join back with us as soon as possible. She's currently outstation, so probably that's why the internet has not been stable. Well, we wait for her to come back. For all our audience out there, if you have any concerns, any issues you would like to ask Dr. Hana during this session, or you actually happen to catch us like after our live broadcast, feel free to ask. We will check in with Dr. Hana. Oh, Dr. Hana is back. We will check in with Dr. Hana and come back to you. So leave your comments or your questions in the live chat or the comment box, and we will get Dr. Hana to come back to you. Welcome back, Dr. Hana.
Yes. I'm sorry about the connection. I'm actually live from Malacca.
Yeah.
All right. Over here it's bright and sunny, just like our Miss Pa, very bright and sunny. All right. Let me just share back my screen.
Yes, sure.
Okay. All right.
Yeah. We're talking about
Okay.
picky eater and sensory, the highly
Issue.
correlated, yeah.
So okay. All right. So there are two types of sensitivity issues. Usually it's hyper or hypo. Okay. The most common one is actually hyposensitivity, where they like all the crispy food, and then like ayam gunting, you know, all the kerepek, they like that kind of food. If the hypersensitivity children, they like more soft food compared to the hypersensitivity. Hypersensitivity is like when it to be touched. So it is actually like the one what they are feeling inside their mouth. So they like to be more softer, on a softer texture. And as for the hypersensitivity, they need more stimulant. So that's why they like more crispy textured food. Okay, when we talk about more crispy textured food, usually it's fried food. Deep fried food. So if deep fried food, usually it's higher in calorie. Okay, so that is why sometimes when we see them, during the first few years, for example, until 5 years to 6 to 7 years old, they are in a normal range. However, when they grow older, they might be overweight or obesity. All right, because if they keep with that kind of diet, which is higher in calorie and lower in nutrient. Okay, so I've covered the first one, and then the second one is feeding difficulties likely to become a determining factors in the nutritional status. Feeding difficulties also associated with poor health nutrition status, because when it is actually interrelated, when the children are have sensory issues, so they have a very limited food repertoire. That's why they could not meet several nutrients in their diet. It is very it is when I say this, usually the most common nutrients that are lacking are the micronutrients, the one that we only need in just a little bit in our diet. So because if in our normal diet we have variety of food choices, and even like today I feel like eating mee soup, and tomorrow I feel like eating nasi campur, you know, although today mee soup, my mee soup doesn't have a lot of vegetable, but in my nasi campur I can, you know, have my vegetables and everything. So although we do not have them on an everyday basis, but in a long term we manage to fill in all the requirements, the micronutrients requirements. However, in children with picky eaters, because of their very limited food repertoire, they only eat that kind of food every day. So we can see that in a long run, their micronutrients level in their body is actually quite low compared to the normal range. Okay, so that is why it is important for us to kind of open up their food choices, so that they can eat more variety of food to fulfill their nutrients needs. Okay, apart from that, because that is long term, and usually it's very clinical feature, you have to, you know, take blood and see the readings, micronutrients reading from the blood readings, but there are also some clinical examination that we can see. We can identify what are micronutrients that is lacking, micronutrients deficiencies in the children. But the one that is quite immediate is constipation. All right, because less fiber, all right, and then diarrhea also sometimes, and abdominal pain. Because usually it is more related to the fiber and the probiotic intake lah. All right, okay. So because of this disruptive behavior at meal times, they are at risk, as what I've mentioned just now, in suboptimal intake of biotin. This is from the research they found. They are lacking in biotin, risk in lacking in vitamin K, iodine, omega-3 fatty acids, choline, which play a role in metabolism and bone and also brain health. All right, in the long run especially. So children exhibiting food refusal tended to have increased calorie and nutrient intake. So they have higher calorie intake, but the nutrient is actually, the quality is quite low. All right, all right, all right. So okay, so now what I like to, for everyone of us to take one step back, you know, kind of like, okay, developing growth. Okay, so all right, so it's actually quite simple. Okay, you just can go to this website, all right, the www.cdc.government healthy weight/BMI/calculator.html. Okay, and also you can just type down Peditools, Peditools. That one is much easier. You just plug in the number and then they will give you straight away the nutritional status of your child. Okay, but however, there are actually two different growth chart. The one on the blue color is actually for boys, and the one on the pink color graph growth chart is for girls. Compared for us, kalau for adult, we are all the same kan, BMI kan, but for children, it's actually slightly different. Okay, so okay, this is how we read like
Sorry, Dr. Hana, I think we lost you again. Right, for those of you who are actually joining us live today, this afternoon, or probably after our live session, do click into the calculator, have a look. It is good to know where our children are, especially when it comes to weight. Weight, I think, is one of the most easiest to identify and monitor, see whether our children are actually growing healthily. Of course, Dr. Hana also mentioned about, probably need to do some form of blood test to decide if any particular nutrient is actually missing in our children's daily intake in their body in that sense. So that one we'll leave it when Dr. Hana is back, and we'll ask her how to get it done, how frequent should we get it done, who do we see to go and get all of that done. Okay, she's back online.
Yay. Okay. So I can hear just now how frequent should we check, is it?
Yeah.
Yes.
Yeah, because we talk about picky eater, right?
As
So
frequent
yeah.
as 6 months. Yeah. Yeah, we can have it as like 3 to 6 months because child do grow quite rapidly, especially with good nutrition. Sometimes we can see they are growing quite rapidly, especially when they are entering the puberty age. If they're entering the puberty age, then they will go up the height, that kind of thing. So if we can see that it's a little bit slow, then probably we need to go and check. Especially, okay, so here, if your child is above or less than 5th percentile, then that is indicator for you to go and see the health practitioners and probably discuss, could you just give it a look, probably the diet quality or something like that we could do some intervention on it. Okay. All right. So just to let you know, because this is BMI, so we just plug in the child's weight, divide by their height in meter squared, and then you will get the BMI. So you just plot the BMI. For example, I got here an 8-year-old boy. His weight is 30 and height is 135 centimeter. So he'll be in 16.4 BMI. So we just look refer to the age here. So 8 years old and 16.4. So somewhere here. So near 50th percentile. So this boy is in healthy weight range. Okay. All right.
Yeah, Dr. Hana, you also mentioned these chart are American, right? So we generally know the Westerners a bit more heavyweight than Asian. Does it
Yes.
matter?
We can definitely check with because as for now we do use the Western growth chart, okay, but we do some calculation. The health practitioners can do some calculation to compare with their mom's and dad's height. To just check. We do could calculate that. Okay. All right. So so you can either check annually, okay, every birthday they can check that, but if it's in higher range or lower percentile, you can check more often lah. Okay. All right. Then, okay, what are the nutritional issues relating to ASD? Okay, so these are the one that most commonly brought up during our discussion.
Okay, I think we're losing Dr. Hana again. Okay, so it's all right. We'll wait for Dr. Hana to come back. For those of you who are actually joining us live this afternoon, if you have any questions from Dr. Hana, you can type it on the group chat, live chat. Or those of you who actually probably watch us after, it's all right. You can still put in your comments. We will get in touch with Dr. Hana and get Dr. Hana to reply to you. While we wait for Dr. Hana to come back, we talk about picky eater for children with special needs. It's actually very, very common for us. Even in at 9th story, we do have a few students who kind of like a little bit pickier. They only eat like crunchy stuff. So Dr. Hana also shared earlier on, because of that hypersensitivity, that's why they are seeking this hard food material. That's the reason why they only pick certain kind of food. If they are avoiding it, that's why they actually seek softer food. So for parents with children with ASD, if you do have them, what we then need to do, I think, as parents, is be a little bit more creative. Since our children like crunchy stuff, right? Maybe make our own nuggets. Even within nuggets, we add in carrots and all the vegetables, just chincang, and make it like nugget shape and kind of like serve it. Okay, Dr. Hannah is back. Dr. Hannah, you want to check your line? Yeah. Okay, the
Miss
line.
Fortuning.
The line is still, I think, relatively not stable. Yeah.
Right.
Okay, please.
I'm very apology for the frequent break of the internet unstable, because I'm outside my area in Melaka now.
Right, right. Maybe you want to share the one
Okay, never
before,
mind.
because you were in still introducing the area of focus. So at least we know. Yeah,
Okay.
yeah. Mm.
Okay. So, all right. These are among of the most common nutritional issues that are being brought up in our clinics, and also discussion among our researchers and doctors. There are five things. First is about sugar. All right. Whether sugar activity among children, polyunsaturated, it's not microbiota. All right, are usually related when cut but to prebiotics. Right. Okay, so when we are talking about there's a lot of study relating to gastrointestinal gut microbiome. Patient with ASD display significant behavioral manifestations such as anxiety, self-injury, and also aggression. So that's why sometimes there are certain studies that look into the child's gut microbiota, whether that the numbers of gut microbiota in their gut system might be one of the triggers that causes their changes of behavior. Okay, so from accumulating evidence demonstrate that the gut microbiota is directly or indirectly associated with ASD symptoms, in part by influencing the immune system and the metabolism. So it is still yes or no thing, because the challenges in doing research among children with autism spectrum disorder is that to get a homogeneous samples, because usually a good study is a big study with a homogeneous sample. So we know that it is almost quite impossible to do that. So but the researchers are doing very, very great in terms of getting pull them in groups and to see whether they are actually answering to the research question. So so whenever we take the outcome from every studies, we also have to remember that it might reflected for only only to that particular group. It might not be representing the whole SD children. Okay, all right. So it's okay, let me just share the next one. Okay, so from the evidence, it's also said that modulation of the gut microbiota is a potential therapy in children with ASD. So that is why some do suggest taking probiotics or prebiotics. Okay, I'm not sure in Malaysia we do have the fecal microbiota transplantation and diet. I think all of this is, as what I mentioned just now, we have to still consider the success rate of it. Okay, so it might be successful or it might not be successful. All right, but you have to work closely with the pediatrician and also the dietitian that involved in that particular therapy, I would say. All right, then since probiotics may prevent intestinal inflammatory disease or diseases by regulating the intestinal tight junction protein expression and barrier function. Okay, what does it mean? I think it's here. Okay. All right. It says here that compared with control, children with ASD ingest fewer fruits, vegetables, and proteins and have a significantly lower daily intake of potassium, copper, folate, and calcium. Food intake influences the composition of the gut microbiota. So that is actually the link because of their food limited food repertoire. So, and some of them just, even I think most children, it's quite a challenge for us to get them to eat vegetables, especially fruits is not that bad, but vegetables is you have to be very creative. So it's actually influencing, the healthy, the gut microbiota. And then when we talk about gut microbiota, when we look at the studies, there are specific gut microbiota that might improve, not just all types of gut microbiota that might have a benefit to the gut, right? So whenever we talk about probiotic, so we are opening more questions, but I know, because even I do also some studies relating to parents stress factors as coping strategies. We can see that from parents with ASD children, you guys are very resilient. You are always one step ahead. So that is actually what's wonderful about parents and also caregivers for children with ASD. Okay. All right. So, okay, PUFA. Okay. Some says that PUFA might help with the learning ability of the children. Okay. So, again, there are yes or no results from there. Okay. So you can see here evidence of low quality. All right, because studies, as I mentioned just now, suggest that using PUFA did not increase the risk of minor disturbances to the digestive system, including studies reported no other types of adverse effects. Okay, so even both studies reported on ADHD-related behavior. However, the format of available data did not allow us to readily combine them to reach. Sorry, I can't read that. Studies reported no secondary outcome. So meaning that it's still from the studies, it is very, very poor or not strong evidence saying that PUFA does help with the learning abilities. Okay, so then we go to zinc supplementation. This is more of a biochemistry part of the metabolism. All right. So okay. The first part is actually explaining about the synapse and everything. And let me just read the second point. It says that zinc was found to increase transient reversibility with neuronal depolarization of synapses, which could affect shank and AMPA localization and activity, which given the zinc sensitivity of young neurons and its dependence on SHANK2 and SHANK3, is actually there's two shanks that involve with the metabolism. All right, genetic mutation and or environment in cells during early development could impair synaptic maturation and circuit formation. Sorry, I could not read that one. Okay, but let me just go back. Okay, so it says what it says here is that when looking into zinc level among ASD children, you can see that from the studies, they are actually quite lacking compared to their typical peers, all right? So, and then that, because of the low level of zinc in their bloodstream, it actually causes the neuron function of the brain. So that is why there are some studies saying that maybe giving zinc supplementation might help in improving the synapse just now, because we know that synapse, they catches all the information and then they bring to the brain to be understood lah, kira macam tu kan.
Yes, yes.
Alright, okay.
But I also read at the bottom that it's actually no study done on humans yet.
Yes. So that is like as a very big point there. Okay. So we still haven't got any studies in human. So we can say that if it is successful, it is only until the cell level. Not even in animal and human studies. So it's very, very preliminary finding, we can say.
Still very initial stage. They can't
Yes.
really okay.
Betul. But it's always a good thing, to venture on later in the research area. So that is why it is it would be very, very helpful to get participants that fits our inclusion criteria, to see whether the theory is working among us lah, among human. All right. Okay, then we have elimination diets. Mostly elimination diet is related to food allergies, kan? So the most common one is gluten-free and casein-free diet. Okay, it says here, it is important to realize that the rationale for this diet is not the same as for a child who has gluten enteropathy or celiac disease. Rather, it is hypothesized that some of the symptoms or behaviors of autism ultimately results from the leaky gut syndrome. Macam tu. So kalau yang if it's the celiac disease, memang it means that the body could not metabolize gluten. Okay, so it is very, very crucial for that individual to remove gluten from the diet. But however, among autism children, there's no strong evidence saying that gluten-free, casein-free diet will definitely improve the behavior of ASD children. But I understand there are many families who are willing to try. All right. So let me just go to the next point. Okay, probably I just explain a little bit on the why. So because of the theory purpose that the gluten from wheat and the casein from dairy products improperly absorbed because of a leaky gut, increased intestinal permeability, meaning that kalau kita tengok our strainer, probably its bigger holes compared to the normal permeability, all right, resulting in larger opioid peptides to go to sift through the surface, the intestinal surface, known as gluteomorphins and calciumorphins, being absorbed into the bloodstreams. Okay, so once circulating, it is thought by some that these opioid peptides cross the blood-brain barrier, adversely affecting neurotransmission and even possibly inhibiting central nervous system maturation, of all of which have been implicated in the symptoms and features seen in autism. So this is the theory behind why some practice the gluten-free and casein-free diet. All right. So points to wonder. Some researchers point out that data suggests that some children who follow GFCF diet, the gluten-free, casein-free diet, experience essential amino acids deficiencies and bone loss. Okay, so so let me just finish this one first before I comment on that. Okay, systematic review identified that need for additional studies addressing the safety and efficacy of the diet. This review also delineated the costs and challenges of the diet, including difficulties in following the complex modification, cost of the specific foods, lack of palatability of some GFCF foods, additional time in preparation, and fifth, risk of nutrient deficiencies, particularly calcium, protein, vitamin D, folic acid, and B vitamins, especially in autistic or children with autism with self-limiting diets. So what I like to say here is that whoever comes to us, especially to the dietitian with families with ASD children, and they say that they are practicing GFCF diet, we will not say that, please stop, don't do that. No, we don't say that. But what we suggest that whoever wants to try the GFCF diet, you have to work closely with your health practitioners, especially dietitians or nutritionists who are able to help you out. Is because of this, because we know that children needs lots of nutrients for their development, all right? And GFCF diet is actually limiting some of the nutrients, as mentioned here in the systematic review, saying that calcium is very, very important among children. Even us, actually adults, we do need like 2 glasses to 3 glasses of milk in a day, kan? Apatah lagi for the children, they need their calcium, especially in their puberty age, because that is the time where their bones are like sponges. They will absorb all the calcium that they get from their diet. Okay, so from there, when they have passed the puberty age, their bones are strong enough, okay, to sustain until the end of the life lah. So that is why it is that is actually the window period where we want the children to drink more milk. If calcium, the one very simple example is actually milk. We also have some other dairy products, right? For them to absorb as much calcium that they could get, so they have a stronger bones. Because I found some studies saying that the osteoporosis prevalence among individuals with ASD is much happens at an earlier age compared to those their typical peers or other adults with the same age, right? Because for us, probably after a certain age, probably 45, 50, like that, kan? The risk of getting osteoporosis is much higher, but they are at a lower range, the lower age, earlier lah, earlier age, yeah. The earlier age, because of the calcium intake tadi tu. All right, protein, yet again, is also one of the most important nutrient for them to grow. Vitamin D works hand in hand with calcium. all right, folic acids, and also the B vitamins. Okay, all right. So whoever wants to practice GFCF diet, what we usually do is that we will explain what are the things that we have to work on, meaning that probably up to what kind of menu that they could get, where they should get, and how to, where to get all the ingredients, you know, because they usually they a lot, because gluten mainly comes from wheat product. And then wheat product, we have breads, we have from wheat, even some noodles, as long as they use flour. Okay, wheat flour, so
Yes.
you have gluten in it lah, kan? So there's a lot there out there.
Cannot eat if we, I think to go into gluten diet, for me personally, I think I'm dead.
You have to cook yourself, you know. And then in Malaysia, we have very limited lah, I would say. I mean, you have to find that special health and wellness shop, you know, to get all the special noodles and everything, kan? So you're not, I mean, if plus even they are children, they want to enjoy their food, kan? So and then you are kind of limiting their food choices. But whoever wants to try, and then please do discuss that with the health practitioners or the dietitians, because we could actually work it out together. All right. So as for the conclusion, autism is a multi-faceted with physiologic and psychological problems that can span several areas in healthcare, thus requiring an interdisciplinary team approach. I think Minds Theory are doing wonderful job with this. You know, there's a whole list there. Okay, that's wonderful to see. That's a wonderful effort by Mind Story. And last but not least, in particular, a child benefit most when the dietitian, if talking about nutrition wise, works closely with behavioral developmental pediatrician, pediatric gastroenterologist, and or pediatric allergist, along with occupational therapists, speech pathologists, psychologists, physical therapists, and also others. With that, thank you so much for your attention.
Thank you so much, Dr. Hannah. This is very, very interesting. Oh yeah, before you stop sharing, please share about your books and your biscuits. That was so super interesting for me.
Sorry, okay. Just a quick one. These are both the products. The on the left side is actually a book called Anak Autism, title Anak Autism Nak Makan Apa. This one in Bahasa. We actually in the process of printing the English version of it. All right. Both and the second one on the left side is our newly launched, just last Friday, newly launched product. It's a gluten-free, high fiber, and also sugar-free. You can see we got the HCL logo, the Healthier Choice logo. We are very happy to share with you that we are the only cookies that receive HCL logo compared to other products. The other products are mainly cracker, but ours is actually like biscuits with flavor lah, macam biscuits, chocolate biscuits that managed to secure the HCL logo. So I'm very proud of our product. Both of them, thank you. Both of them, we can get it from Shopee. The book is more on looking into understanding the issues relating to eating behavior and what can we do. Eating behavior and some other things that I've touched a little bit today in our session. And what can we do to overcome the problems. And we also have some recipes share and activity pages for us to practice, kind of like, okay, we have read through, okay, why not we try and do it ourselves, you know, the planning especially. We always believe in when we learn something, if we are able to practice it, we can remember better the points that we have learned, kan? Okay.
Yes. Yes,
So please feel free to give it a look. For the biscuits, it's actually on sale. The manufacturer said that it probably will the sales will they will keep the sales for another 2 to 3 months from now. Okay.
right. We
Thank
have
you.
also shared the link in the live chat, so feel free to click on the link and order a copy of Anak Autism Nak Makan Apa, a book from Dr. Hana, as well as the biscuits. Give it a try. I believe with the healthy choice, high fiber, gluten-free, sugar-free, is something that I think parents are willing to introduce to the children as well. So thank you very much, Dr. Hannah, for sharing. We do have questions from our live participants. Kimberly said, "Hi, I have done allergy testing for my girl. She is not allergic to cow milk, wheat, butter, only seafood and mites. Then does this gluten and casein free really help for her?" Okay, Dr. Hannah's line now is frozen. Well, we shall wait for her to come back before we get her to answer Kimberly questions. Yeah, so if any one of you who are joining us live this afternoon, feel free to actually share your question in the live chat. We'll get Dr. Hannah to answer. Dr. Hannah, welcome back.
I catch the question saying that only allergy to seafood.
No, it's not allergy to cow milk, wheat, butter, only seafood and mites.
Or
So
seafood and
should then she go for the what gluten-free, casein-free diet?
allergy to wheat and cow's milk, is it?
Uh,
Might,
allergy
might,
to allergy to seafood and mites,
might.
as in
Okay,
like
but
dust
not
mite, I guess.
oh ya ya habuk-habuk macam
Ah
tu
ah 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 ah.
okay. But not dairy and
Not
not
dairy, not wheat, not butter.
usually no. Usually we don't there's not strong evidence saying that the GFCF diet will improve if because of these two allergies lah.
Mm.
Because we know gluten free is because of the gluten component in the diet, and the casein is actually casein come from dairy. So the possible chances that the GFCF diet might works is probably might be very very slim for this case.
Right. So let's say a
Thank you for the
parent.
question, by the way.
Thank you,
Mm-mm.
Kimberly. Okay, for those of you who are joining us live, you can ask your questions. If not, my turn to ask questions. So for parents, they have concern with their children,
Mm-mm.
like picky eater,
Mm-mm.
underweight. What would your
Mm-mm.
be, what would be your advice? Go and see development pediatrician. Go straight. Where can they get help?
Okay. Usually what I know is that there's a regular visits to the doctors. All right. And then, okay. Remember that I shared with you how do we check the growth from the growth chart, the growth of our children. Okay. When to see when to I mean throw that questions to the health practitioners is when you see the trend, meaning that if the trend before this is okay, is going upward and suddenly it goes down,
Ah,
or it's stagnantly on the lower end of the growth chart.
right.
So usually we will see the trend, so because the trend is usually more is a stronger indicator that you need to work something out relating to the child's diet.
So who do they see? Any regular doctor?
Okay. First, they can see the doctors, all right, and then usually the doctors will refer to dietitians, for
Ah,
us to assess the nutritional aspect of the child. Because for us, usually we need to have the referral letter from
mm,
the any medical doctors.
mm.
Okay, because from there it will say some brief about the child, and then we will continue from that.
I see, I see. What about the other concern? I think a lot of parents are worried because they're
Mm-mm.
picky eaters, so they're always very skinny.
Mm-mm.
right? But
Mm-mm.
you know, weight everything is like, let's say on par lah, you know, not high, not too low, but just skinny,
Just what? Sorry?
very skinny.
Oh,
Because
skinny.
then should there be concern, or we just purely rely on a chart and that's the decision factor?
Okay. The growth chart is one of the easiest way for us to identify or categorize the child based on the nutritional status, growth status. And then there are some clinical features that we can actually deficiencies of something. For example, they are quite pale, even before below their eyelid, it is quite pale. All right, and then their hair and their nails are a bit brittle. So there are some that are some of the indication that probably I need to go and see the doctors, just because apart from just being skinny, because skinny it's very subjective from one person to another person. So that's why having the growth chart is something more objective to for us to assess the children. Mhm.
Right. So for children who, let's say parents are worried whether the child is getting enough nutrients, because earlier on you talk about, you know, there are actually tests that they can do to see what nutrients are actually missing, right? At what
Uh,
age do you think, like, you know, parents should start worrying about it and getting their children tested?
oh, okay. All right. Actually, we do not have a particular age lah, where it should be an alarm for the parents. Okay. So what we actually want to see is that the children is growing well, all right, and then besides the growth chart, they are eating a variety of food, all right, and then uh, um, uh, the behavior factor does not really influence the intake or the food repertoire of the child. So your question again was that at what age is it? So
Yeah.
that they need to be concerned. We don't have a particular age that they need to be worried at. Um, uh, as long as you constantly plot the graph and then see the trend, all right, that is actually one of the indicator to 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 see whether we need to see medical expertise or not on that. Mhm.
I see. Okay. So when let's say a parent go and see a dietitian or yeah,
Uh,
dietitian, right? What can they expect? Like should
uh,
they have like, okay, this is my weekly menu?
okay. Understand. Okay. Usually we don't straight away ask them to take blood lah. Macam tu tak. But what we during the assessment, the dietitian will ask one day diet, whole day diet of a typical, what is the most typical diet of the child. Okay, is it different from between weekdays and weekend? If it's different, then we need to take one weekend set, one weekdays diet recall, and another one weekdays diet weekend diet recall. And then we will assess, we will calculate how much energy, protein, carbohydrate, and fat that they got from that diet. That is the assessment that we can do. And we also have this software where we can assess their micronutrient intakes. Okay, usually that can be done probably a day or two. So before you meet your dietitian, it is best for you to share the menu or the diet intake with the dietitian, so that they can plug in the software and then the software will give you all the numbers. From that, it will indicate whether your child is meeting the what we call it as recommended nutrient intake of Malaysia for their age. Macam tu. So from that, if there are some deficiencies that are being detected, then the dietitian will modify the diet, will suggest some modification, what to take or to modify to improve that particular deficiency. Usually that is more on our standard practice, but we understand among children with this is not as straightforward as that. You know, we come up with one menu. Okay, now you can go back and then try this. It's not as simple as that. We understand that very much. So what we do is that in our clinic, especially what I can share in our multidisciplinary clinic, we will assess what causes the limited or the eating behavior problem that might occur. So we will try to rectify that first, identify and try to rectify that first, while maximizing the nutrient intake based on the recommendation for that particular children. So we kind of like have a discussion among the health practitioners. Okay, I hold on to this aspect because I'm going to let you settle yours first, probably the OT part first or the psychology part first, while as a dietitian, we will try to maximize whatever food or nutrient that that particular child can get at that point of time. And then for the next visit, after probably that the other issues has been resolved, we will educate them on how to increase the food repertoire. There are some techniques that can be done. For example, the food chaining technique, all right, where we will focus on probably first the texture of the food first. All right, so we change the texture of the food. Later on, we change to the food itself. We keep the texture and then we change the food, and then we change the texture. All right, probably make it softer while what is it called? While trying new foods. So that is some of the techniques that we do in the clinic to help parents to plan from the current diet to what is our goal diet. So that are the things that we do in the clinic as part of dietitian.
Nice. Yeah, I know to introduce change in diet for children, especially even for children with autism, it is a long process. Like you say, it's not an overnight thing. Like today, okay, today this new menu, tomorrow masak jalan. I think for our children with autism,
Yeah,
it can be a little bit tricky. Okay, Kimberly actually has another question. My girl tested
true, true.
vitamin D deficiency low. We can get recommended,
Vitamin D.
yeah, vitamin D drop. What's your thought
Okay.
on it?
Okay, usually if vitamin D, the best source of vitamin D is actually from the sun. So to get to do it, I mean, usually what we suggest is that do activities, you know, go play at the garden or the park, you know, during around like in the morning session to get the vitamin D, because that is the fastest vitamin D absorbed by the body. The health practitioners do as an immediate intervention is by giving vitamin D supplementation. All right. However, vitamin D should come to
Oh no, we are losing you again, Dr. Hana.
there's a deficiency in vitamin D. Usually they will give vitamin D supplementation.
Okay.
All right. And then hopefully after a period, several in a certain duration, we'll check again. If it's improved, then they can stop the vitamin D supplementation.
I see. Okay. Okay. So for again from Kimberly, from my typical younger 18 months old girl
18 months. Okay.
who consistently wake up at night for milk and hard to sleep
Okay.
back. Does magnesium
Okay.
oil spray help her? I have no idea what's magnesium oil spray.
Okay. All right. Usually, I haven't heard of that. Okay. And usually, what we will always give any recommendation based on strong studies that we have come across. We haven't come across that. It is purely from parents' decision, and as for us, we cannot say that it will help or it will not help, because there are very lack of evidence on that at this point of time.
Mhm, mhm. Yeah, I know. As parents, I know we always very eager to support our children, to help our students. So, and there are actually a lot of products out there who has claims that certain certain food will help our children, certain whatever will help our children. Ultimately, from our perspective, we have to go back to research, and basically
Yeah.
validity is not just about testimonials,
Mm-mm.
but also some form of certification and
Yeah.
research back products that's to make
Mm.
sure that our children are being taken care of, and
Mm-mm.
we really provide the best for them. Okay, so I think that's okay. When it comes to supplements, then
Mm-mm.
I know as parents, because of diet, we want to kind of like make sure our children get enough uh,
Mm-mm.
nutrients, right?
Mm-mm.
So there are
Yeah.
like milk and there are like vitamins, multivitamins and whatnot. So would you as from your expert perspective, would you just tell parents, don't worry about it, just go and get it? Like see doctor, get tested only when you see
Mm-mm.
red flags.
All right. So there's thank you for the question. This when we talk about supplementations, I always like to put in two different perspective. Okay, first for or circumstances. Four is for typical children, and one is another part is the special needs children. For typical children, we know that mainly they do not have eating behavior problem, so we always advocate on eat well, enjoy your food, eat variety of food, and eat moderately, kan? Macam tu je, same as adult, because we know that from the foods that we get, from the variety of foods that we eat, we able to fulfill the nutrients that is required by our body. Even sometimes our body will give some senses that I think I'm lacking in protein now, and then sometimes you crave for protein or something like that, kan? That do happen. Okay, but for special needs children, um, what we do is that we will assess the dietary intake, and then we will see how long is the transition process from probably now very limited food repertoire, or the diet now, which is quite lacking in several macronutrients and micronutrients, to our goal diet. If the prognosis is saying that it might take a longer period of time, then having supplementation is okay for these children, because we understand that it takes a while to get from point A to point B. So to have supplementation, vitamin supplementation is okay for us. Okay, you can take that. And even if you mentioned just now milk, is there any like high calcium or okay. Okay, milk, because if in our clinic we do have some certain milk that is higher in calorie, to boost the or to equip the child to fulfill their energy requirement, because sometimes they eat very little, all right? So having to take that milk is very, very helpful. So meaning that, for example, by drinking 1 glass of that particular milk equals to 2 glasses of normal milk, then it's okay. Okay, that is okay. No problem. It's just that sometimes there are some issues that because after a longer period of time, they might increase their body weight, they increase their BMI because it's higher in calorie. So regularly check with your health practitioners.
Right. Okay. So that's pretty much on diet. Then I want to ask a very personal question, a question that's like,
Okay.
we kind of like worry all the time. Like, because, like you said, because a child's growth is also dependent on parents' genetics, right? So let's say a parent who is like, huge in size, and therefore the children is huge in size, right? So comparatively, do we just like we then cannot get like when you get a child to compare with peers, because naturally parents are bigger, so the child is bigger. So though we rely very much on the BMI chart, right? But from parents' perspective, because children eat what the parents eat,
Yeah,
right?
this from the same house, same meal.
Yeah. So would you? I know my point of view is always if parents want the children to change, parents first need to change lah, huh? But
Yeah, betul.
working with parents sometimes may be a bit difficult. So what would be your recommendation to, like, for example, like schools, centers like us, like what can we do? What would you do? Because you also work with different group of people to
Yeah.
support this group of children. Then what is your recommendation? What is your thoughts about getting these people to, come in and support these children?
Okay. From your question, I understand, one, what can the parents do, and second, what can the centers do in improving the intake of the children? Okay, all right. Yes. Back to the genetic, there are certain percentage that influence the probably the body stature of a child. With good nutrition, definitely will improve the status, the health status or nutritional status of a child. Okay, that's why sometimes when you see the parents are quite petite and suddenly anak dia macam giant, macam tu tinggi kan, that actually shows a good nutrition that are being implemented at the home in that particular house probably. So yes, back again, children, what I like to share with you, children learn through observation. So that's why you are very correct and very true saying that they will kind of, whatever mak makan, ayah makan dekat rumah, dia akan makan itu juga, kan? So it is quite important actually for the healthy eating to be practiced at home. For example, I have one, allow me to share some of my stories from the clinics and the one that from my friends who shared with me. This one home, okay, the parents usually will have fruit supply every day, meaning that their fruit basket is never empty at home. So the children used to take fruits as the snacks. Even the mother or even the dad will cut the fruits and then eat while watching TV. So they kind of have fruits all the time after meals or even during snacks. And then when the child enter college level, they enter college, it's they because at home the parents will buy, so they kind of dependent on makan je kan, and suddenly dekat hostel macam something is missing macam tu, because because of that the child I mean not child anymore lah, it's quite grown out already kan, that kid themselves will definitely go and find buy fruits and then put in their hostels to share with the friends. So you can see that it is kind of a healthy eating behavior need to be instilled from young, from home and also at schools. And the second point related to centers or even apa nama panggil tadika, kan, macam nursery, something like that, is peer influence. Yes, peer influence is very important. It's also one of the factors that influence the intake of a child. All right, so preschools is actually, or even schools, is actually a wonderful place to instill a healthy eating practice. Because sometimes when we do education, you have like a program at the school, okay, to educate about healthy eating, okay, and then you practice, you show them, the school show them in during their lunchtime or even their snack time, what being taught in the class, all right, so that they will it will show that oh, I do enjoy, or I try what being suggested or what I've learned in the class. And even better if you have like if the center have like a reward system, kind of like whoever able to finish up your vegetables during lunchtime, you get a star. So because they will follow their peers. Okay, oh, I want to be like them. I want to be like this another person. So because children, they want similarity among their peers. So to have that behavior, eating, especially eating healthy eating behavior or practice it at the school, is actually a wonderful effort that can be done in the centers.
Yeah, I think that's a very great tip for schools and operators or daycare centers for these children. Offer reward system to encourage them to eat a little bit more healthier. Okay, that is one. I think we'll take one last question from Kimberly. Is it true that plant milk, like soya milk, is better than cow's milk for kids? Is there any study on that?
Okay, all right. If there's any study on that, I think there's quite limited study to comparing plant milk to animal milk. All right. However, we always encourage animal milk among children, because it will also provide the essential fatty acids and also amino acids that is required by the body, that cannot be produced by our body. So that is why, especially if we are talking about milk and protein, we always go with high biological value compared to the low biological value. The high biological value will come from all the animal products. So it will provide our body with all the essential amino acids or the fatty acids. Usually about plant milk, usually if they have allergy to animal milk, or sometimes for adults is because they want to cut off their fat intake, and sometimes their cholesterol level is a bit too high, so they want to cut off. They still want their calcium, but they want to cut off their cholesterol and fat intake, so they will go for the plant-based milk. But however, for children, if you can go with animal base, go with animal base, because it will provide all the essential amino acids and fatty acids that are being required by the body.
Right. Interesting. My daughter never liked milk, so I
Okay.
opted to give her soya. Of course, when she's older, then I asked her why you don't like cow's milk. She said she doesn't like the smell. So that it wasn't any particular reason why I gave her soy milk. Just that she refused to drink milk. Refused.
Soy milk, if you want to look at the calcium proportion among soy milk and cow's milk, usually soy milk, you need to drink 3 glasses, 2 to 3 glasses of soy milk. That will give you the same amount of calcium in one glass of milk. However, our worry if it's sweetened soy milk lah, because if it's sweetened soy milk, then the sugar part is what we want to cut down, kan? What I can share is that probably the milk can be modify, or you can add some cocoa powder in it, or some
Flavorings lah.
vanilla, so vanilla essence,
Right.
to mask the smell of the fresh milk. I think fresh milk gives more that milky smell compared to the non-fresh milk. Macam itulah.
Okay. Thank you so much, Dr. Hana. Thank you for spending your
Thank
afternoon. Though you're having a holiday, you're still willing to come aboard and
happy and happy to share with
and
everyone.
share with us all the way from Malacca. Right. So for those of you, if you happen to watch our live after live session, if you still have questions for Dr. Hana, you can still post it in the comment. We will email it to Dr. Hana and we'll respond to your question.
Definitely.
Right. Thank you very much, Dr. Hana, for being with us this
Thank you,
Saturday
Miss
evening.
Jean.
I hope you enjoy your Malacca trip, and we hope to catch you again soon.
Thank you.
Thank you
Thank you,
very
everyone. Thank you,
much.
Miss Emily, for all the questions. All right.
Bye-bye.